Welcome to today's review. Today we're going to look at NCK revision paper. Remember, this is an exam that you have to pass before you start practicing in Kenya. All right, so let's get to question 1. Right, the maximum time within which emergency hormonal contraceptive should be taken to ensure its effectiveness is. All right, guys, I think based on this question, it was somehow tricky because most people, okay, there's a confusion between A and C. Okay, NAS A talks about 72 hours. Those are 3 days, especially when you're talking about levogestrel based pills like the Postino 2 pills, the 2 tablets of eugenin, and the microgenin. All of them work within those 72 hours. But we have a new oral contraceptive by the name ulipristal acetate. This commonly referred to as ELA. This one normally works has a maximum duration of 120 hours. So just to ensure that you have all the oral contraceptives that have at least been taken care of, we hope that picking option C will be the best in the best interest, in that it will be able to cover all the three different type of oral contraceptives, right? Okay, the primary functions of research finding dissemination by students is, remember, when you're a student you have to pass, right? You have to graduate, right? And that makes it easier for you to pick, right, to fulfill your academic requirements in obtaining certain academic award, right? And then publication becomes secondary, right? Indicate whether the following statements are true or false. We are talking about pneumococcal vaccine is administered to an infant at birth, 6 weeks, and at 14 weeks. Well, if you look at that statement, this first part of it is what makes it false, right? Because pneumococcal vaccine is supposed to be administered at 6, 10, and 14 weeks. Right, for there. Inactivated polio vaccine is administered orally. Again, inactivated polio vaccine should be administered intravenous, intramuscular, right? So this is again a false statement, right? Oral polio vaccine, oral polio vaccine is the one that is given orally. Inactivated, it should be by an injection. Okay. Number 3, the term population density refers to. Right. This simply refers to the number of people living in a given area, because the number of people in a country is the total population. Number of births in a year, that's a birth rate or fertility rate. And population growth in a given area, that is the rate or the population growth rate, right, which is usually per 1,000 births. Number 5, according to the Kenya Essential Package for Health, a health center falls into a service delivery of. All right, guys, that should be level 3. Remember, level 1 is all about community health services, that is normally headed by community health workers. Level 2 is about dispensaries and clinics. Level 3, as we have indicated, they are primary care services. The health centers belong here. Level 4 is sub-county hospitals. Level 5, county hospitals. And then level 6, these are national referral hospitals which offer tertiary services. Remember, county offers secondary, right? Secondaries are this. Number 4, you're trying to match the helminth with the drug of choice, right? With the drug of choice. So in this case, if you're talking about schistoma hematobium, schistoma hematobium is normally treated using the metryphonet, right? Metryphonet. Although commonly we have praziquantel drug that can be used to treat this schistoma hematobium. Looking at Wichecheria bancrofti, which normally causes lymphatic filariasis, elephantiasis. The best drug for this one is which one? Is the diethyl carbamazine. All right, diethyl carbamazine drug can be used to treat this one. Remember ivermectin. This one we can use to treat parasitic infection, scabies. While albendazole is a broad spectrum, right? It's a broad spectrum drug. All right. Okay. The child is able to sit unsupported at which age? Right? Sitting unsupported. Okay, guys. I think this one you need to pick B, option B for boy. B for boy, right? Sit unsupported. Remember at the period 6 to 7, 3 to 6, this one is going to sit with support. 9 to 12 is going to transition from sitting to crawling, while 12 to 18 months is the child will be able to pull into a standing position, right? Okay, a link will be popping up on developmental milestones. You can try and review all those stages. Elements of culture include elements of culture. Remember, culture includes material and non-materials. All right. In terms of non-materials, we understand language. All right. Language, norms, laws are so important to us. But basing on these questions, at the elements of culture, I'll be happy if you'd be able to pick option A, which talks about customs, traditions, language, and religion, right? And religion. Option D, we have talking about vaginal discharge is normally associated, that is associated with trichomonas, is described as trichomonas. Trichomonas, it is, of course, trichomonas, yeah. Trichomonas is caused by Trichomonas vaginalis, right? Trichomonas vaginalis. And that should help you to get in the vaginalis, the green, okay? It's greenish yellow discharge with the fishy odor, right? Remember white card, like plaques that adhere to the vaginal wall. This is all about yeast infections caused by Candida albicans. While talking about purulent, thick, yellow discharge, this is about bacterial vaginosis. While homogeneous white vaginal discharge with fishy odor, this is bacterial vaginosis, all right? Okay, guys. A proper school environment is characterized by school environment. Remember, we look at the functions of a school, right? Functions of a school, and now the characteristics of a proper school environment. Looking at this option, the best option for us will be which one? Yes, spacious classes with doors opening outwards, right? Shared common toilets. This could be a problem in that privacy will be compromised. Simple seats, right? Simple seats. Simple seats should be an SEATS. The seats, right? That are attached to each other. This is going to limit flexibility and comfort. While a wet playground, it should be dry, right? It should be dry because it should be dry and well maintained. If it is wet, then you are going to have safety will be compromised. They're going to be risk. They're going to increase likelihood of slip falls, and this is a danger to our children. Case studies. Well, if you look at all these choices, you can see that option D is better. They are in-depth, detailed accounts of experimental analysis of an individual. When you look at option A, concerned with gathering information from a sample population, these are just survey or observational studies. Talking about do not provide a causal relationship, these are descriptive. Um, are meant to generate and test hypotheses. Okay, they just generate. Case studies just generate, they don't test, right? Do not necessarily involve experimental analysis for that case. So what's the best option for us? All right. Okay. Contents of research proposal appendix include, all right. So a detailed statement of what you intend to do, why you want to do and how you'll go about it. That's what, why, and how of the study, right? If you look at all the options, option D is best. Study map, budget, and study tool, right? All right. The appropriateness sequence of phases of home visiting is home visiting. We talked of pre-visit, the initiation, then termination, then post-visit activities. So if you look at pre-visit, this pre-visit is there. Initial, this is what is not correct, right? So we have option A and B. So pre-visit, after pre-visit, you initiate, right? And then from initiation working, right? Then we have termination and the post-work, right? Okay, so option A could be the best option for us. Measures of central tendency include all right, looking at the option, we can go with A, will be giving us the best one, this A, right? B are mostly measures of dispersion, right? 15. Two methods of controlling communicable disease aimed at interrupting transmission. Have environmental hygiene, vector control, and sterilization. Right. The correctly matched color code for triaging patients during an emergency response is, alright guys, we have red for life-threatening conditions, yellow for urgent, green not urgent, and then black for deceased. Looking at the options here, remember this should be red, deceased they should be black. Yes. When using anthropometric measurements to assess growth, the nurse expects what? To use weight and height for age, when age is a known, right? Yeah, that's the best option for this one, for that case. The monovalent rotavirus vaccine is monovalent rotavirus is live attenuated. So what is the best statement there? Looking at A is killed or activated vaccine. It should be live attenuated. Selfly administered orally with oral polio vaccine. Yeah, selfly administered with oral vaccine. Given at birth, it should supposed to be given at 6 weeks, 10 weeks, right? Aimed at giving passive, no, it normally produces active immunity, right? So the best option for us is option B. Malocclusion is a form of dental illness. Malocclusion at the best example, the best here, like if you look at option D, managed through scaling and root canal, you do orthodontics treatment. You, of course, most of the you use the braces. It's the main cause of tooth loss in adults. Periodontal and dental cavity are the ones that are implicated in such. It's as a result of erosion process, that is tooth erosion. I think option B is the best option for us here. Brucellosis is spread through Brucellosis, right? Brucella melitensis. Found in goats, sheep, and camels. Brucella abortus in cattle, and Brucella suis in pigs. So the best, how is it spread? Close contact with infected tissue, blood transmission. Yeah, could be the best. Yeah, close contact. Yeah. What makes option B to be wrong? Fecal oral. It's not a fecal transmission. Option C, talking about sexual transmission. Again, fecal oral in option D. Right, that makes it wrong. But next, remember treatment for brucellosis, you normally give doxycycline 200 milligrams OD over at 2 weeks. Clotrimazole tablets, BD over 2 weeks. Right. Okay. Let's look at short answer questions. Outline 5 advantages of syndromic management of sexually transmitted infections. Of course, advantages include rapid treatment, improvement in patient compliance because they are likely to complete their therapy and return to follow up. It's cost effective, there's enhanced access to care and reduction of transmission rates. Right? This protocol also this is very simplified and it focuses on the very common sexually transmitted infection. It reduces stigma and is effective for co-infections, right? And flexible in treatment. Outline 5 key components of a community diagnosis report. When writing a community diagnosis report, you must give a community profile, that's the demographics and the geographical information. You also give the health status indicators, that is epidemiological data, statistics on morbidity, mortality, prevalence of disease within the community. Also the health seeking behaviors. You also talk about identification of health problems, right? Priority health issues and the risk factors, community resources and assets, stakeholder analysis, key stakeholders, community diagnosis statements, nursing diagnosis, intervention strategies, evaluation, and also conclusion and recommendation. Outline 4 qualities of a good research topic. A good research topic should ensure there is relevance, clarity, feasibility, originality, interest, specificity, significance, ethical consideration, availability of resources, research ability. Explain any 3 non-probability sampling methods. You could talk of convenient sampling, judgmental or purposive sampling, snowballing, quarter, self-selection sampling, heterogeneous sampling, and so many others. 6 roles of a community health nurse. Of course, we can work in, can assist in health promotion and education, in assessment and surveillance, in disease prevention and control, in advocacy role, care coordination, home visiting, collaboration and partnership building, crisis management, research, evidence-based practice, policy development and implementation. Responsibilities of 4 key implementers of primary health care. You could talk of the community health workers, the nurses, the physicians, the public health officials, health educators, pharmacists, social workers, and so many others. Describe 3 pillars of Vision 2030. We have economic pillar that normally aims to achieve a sustained economic growth rate of 10% per annum and to create a globally competitive and adaptive economy. Or the social pillar, this aims to promote equitable social development and improve the quality of life for all citizens. Political pillar that aims to promote an issue-based, people-centered, and participatory democracy, ensuring good governance and the rule of law. Right? Okay. So a care CHN is working in a healthcare center, encounters a patient with a history of a bite from a rabid dog. You need to define what the term rabies, describe clinical stages of rabies, and explain prevention. Looking at the definition, rabies is a viral zoonotic disease that is caused by the rabies virus, which belongs in the genus Lyssavirus. It is primarily transmitted through the saliva of the infected animals, most commonly through bites, and it majorly affects the central nervous system, leading to encephalitis. If untreated, almost invariably results into death after some onset of symptoms. Clinical stages, you have the incubation period, the prodromal stage, right? The acute neurological phase, paralytic or the damp rabies, coma, and possibly death. In terms of prevention, we can do vaccination of animals, public health awareness campaigns, post-exposure prophylaxis, control of the stray dogs, surveillance and reporting, educating healthcare providers, legislation and policy, research and development, collaboration with veterinary services fosters, collaboration between health and veterinary services to promote one approach in rabies prevention and control. Could also have emergency response plans, community engagement, behavioral modification. Last question was about home-based, where you need to define what home-based is, principles of home-based, and roles of key players of home-based care. So home-based refers to the comprehensive health care approach that provides medical and therapeutic and personal support services. Those are the principles and those are the key players in home-based care.